Hi everyone, welcome back to our 30-day Contigo Wellness Challenge, where we're challenging you to learn a little more about mental health and maybe implement some of these strategies that have been presented. Today we're really excited to have Gabriela on with us, and she's going to share a little more about the work that she's doing here in Austin, Texas.
Well, thank you for having me, Diana. I'll give you a little bit of background of who I am, what I do, and we can get to jumping in and talking about things. But again, I'm very grateful to be in this space. My name is Gabriela Hurtado, and I'm a psychologist here in Austin, Texas. I'm the co-owner of a practice named Prickly Pear Therapy and Training, and what we focus on is providing trauma-responsive care to folks in communities of colors, specifically Latinx folks. And most of my work is centered around trauma, of course, but specifically on eating disorders and suicidal behaviors. And so part of what I've been doing for a while is I worked at different levels of care and now in outpatient services, which means people come in once a week and we talk about what's going on, and then we connect them with services as needed for dietitians, for psychiatrists, for doctors, so we can have like a team of folks that are really attending to their needs. We do have a dietitian in our practice, and so that can also foster a lot of different collaboration and easier for people to connect what they need in that regard. I don't know, I'll pause there a little bit. I throw a lot of information out.
So you mentioned eating disorders and suicidal behavior, because both of those things are really important, and it seems like we're seeing a lot more of those two disorders coming up a lot more frequently. Can you speak a little bit to, like, how would someone know if they have an eating disorder? What does that look like?
Right. So I want us to think of eating disorder as kind of a spectrum, right? So there's different ways in which we connect with food, going from what we know as intuitive eating, where we are very connected with our bodies and we know what our bodies are needing in that moment, and we're able to attend to those needs. And in the other side, in the extreme, we have eating disorders, where there are things that are getting in the way of us being able to attend to those needs. And sometimes it can be fear around food, a disruption in the connection with food. There can be other physiological things going on that get in the way of that communication. And then there's something in the middle called disorder eating. And that is when there are things that get in the way of our intuitive eating in connection with our bodies, but also are not as severe as an eating disorder. That doesn't mean by not as severe, I mean that they're not meeting clinical criteria for an eating disorder. That doesn't mean that they're not interfering with our quality of life, with the things that we want to do. So for example, in our community, I think it's very common for folks to be dieting for many years, right? That's something that sometimes we grow up with our mamas and tias talking about. And so that is a form of, it could be something that could lead to disorder eating, where we're not able to eat in a way that feels good, or we're spending too much time thinking about food. It's taking a lot of space. It's hard to connect with what our body looks like. We might feel bad about the weight that we look like, and then do things to compensate for that. When we're moving more into eating disorder, not only are we going to see an impact in our quality of life, but we're eating and food is going to take a lot of space. There's going to be a lot of fear, extreme fear around gaining weight. There's going to be extreme fear about approaching certain foods. There's going to be some difficulty sometimes stopping after fullness, so we'll eat above and beyond what feels good in our body. And that will be coming from a place more of our emotional needs, our distress, our anxiety. And then we'll do sometimes things to compensate for those eating binges or what feels like a binge in a way that is no longer supportive for our body and is actually creating enough stress that the normal processes that happen within our body as a result of eating regularly and providing nourishment are not happening. So for example, something that will happen is we might lose our period for women. We might reach a BMI or a weight that is very low. We might lose body mass. We might also gain weight pretty quickly, a large amount of weight in a short period of time. We might be spending a lot of time at the gym, a lot of time using different things to change our weight, like laxatives or diet pills, um, among other things. But it's going to be a more extreme version of disorder eating where, we might skip a few meals, we might not be really in touch with our hunger and fullness, which can happen a lot from years of dieting, but also as a result of trauma. And so there's going to be that distinction when we're intentionally engaging in some behaviors that we know might not be helpful, but it helps us regulate, or we simply cannot approach food in a particular way versus struggling with that connection in our body alone.
Yes, thank you for sharing that. So you mentioned the link between eating disorder and trauma, and then I know part of the work that you specialize in your practice is also suicidal ideation, and so I'm curious if there's also a link there between eating disorder and the suicidal ideation.
Yeah. So it's not uncommon for folks that exhibit eating disorder or disorder eating behaviors to also engage in different forms of self-harm, which is separate, right, than that ideation, but that is there. And it's also not uncommon for depression, very severe anxiety, body dysmorphia, and OCD to also happen alongside with eating disorders. Sometimes as a means of regulation, a lot of patients, as I said, will disclose either self-harm or very chronic suicidality, where it's triggered by things that are going in their body, a lot of physical agitation, a lot of that anxiety, but also because eating disorders are very difficult. They're they're one of the most, I would say, impactful disorders, because it's, if you think about it, we're thinking about this at least 3 times a day, right? In every social connection, especially in our communities. And it's really having a very strong impact in our body, in our minds. And so people can feel really stuck, that even though they're doing these treatments, they're wanting recovery, because it's really hard, we can find ourselves in that very hopeless place, feeling very stuck, and that leading to that suicidal ideation or attempted suicide. So, and I want to say that some eating disorders are actually some of the deadliest mental health disorders that we have in around. Unfortunately, there isn't a lot of accessibility to treatment for this particular disorder, which requires a lot of specialization to be able to provide that care. And what we're seeing too is that, especially in our community, there's a lot of limited resources. So resources that are out there that are limited in general are not available in Spanish, might not be always considering the different things that will be relevant for our culture, for our communities, right? And so people might be really hesitant to engage in treatment that way.
Yeah. Wow. Well, this has been really insightful information that you're sharing. If someone is watching this and is maybe contemplating whether they have an eating disorder or know someone who does and have some concern, what advice can you share with them about getting started with treatment or therapy?
Yes, there's a few websites that they can visit that have, I know, information both in English and Spanish, and I'll make sure that that's linked and available to us. So the International Association of Eating Disorder Professionals has information available both in English and Spanish, and has questions that you can ask yourself if you're struggling with food and you're thinking, okay, there's something here. And I would say there is a Central Texas Eating Disorder Specialist who have a directory of professionals available that I think a lot of us do consultation and can have a conversation around some of these concerns and be able to then provide referrals as needed here in Texas.
Okay, well, thank you for sharing that. And what about the work that you do? Where can people find your information to learn more about the work that you're doing?
So they can go to our website, it's pricklypeartherapy.com, or our social media, Prickly Pear Therapy. We're on Instagram, on Twitter, on Facebook, and we try to provide information there, but also promote accounts promote folks that are doing similar work that can be good resources. I know that Nalgona Positivity Pride provides a lot of information for our community. Decolonizing Therapy will do that too. And so there's a few folks out there, that will promote their content, that are always talking about how this affects their community and the different barriers to care, but also what are some of the resources that are out there too. Latinx Therapy, I know, has talked a little bit about eating disorders, and they have also wonderful resources in English and Spanish.
Okay, perfect. Well, thank you so much, Gabby. This has been so great, so informative. We really appreciate your time today and sharing some of your expertise with us. That is so important. So thank you again for your time.
Yeah, thank you for having me.